Now let's talk about health monitoring, types of health check. There are a range of health checks available from those carried out by your own doctor to workplace assessments and specific tests required by certain occupations or organizations. The aim is to identify those at risk of specific medical conditions and or ensure people meet safety standards required to carry out a particular job. Checks not only include medical tests by health professionals, you can also monitor your own health at home and online. Many medical practices offer health checks when you sign up with them, as well as ongoing assessments when needed. A checkup is likely to include blood pressure, body mass index, and blood tests to screen for conditions such as high blood sugar or high cholesterol. The aim of the checks is to assess your risk of developing conditions such as a heart attack, stroke, kidney disease, or diabetes. Depending on the findings, you may be offered lifestyle advice, treatment, or sometimes further tests. Preparing for a physical. You do not need to do much preparation as health assessments aim to evaluate your baseline health status, but gathering some background information will help your doctor. Find out about the medical history of your immediate family, particularly for any conditions such as strokes, heart attacks, diabetes, or high cholesterol, as well as cancers, including their ages at diagnosis. Take a list of the medications you take regularly, including those bought over the counter, such as pain relief, vitamin and mineral supplements, as well as non medical preparations. Make a note of any known intolerances or allergies. Bring a list of vaccinations you have been given and when you had them. Write down your own concerns or questions you want to ask the health professional about links to family medical history, for example. Many companies offer medical checkups when you join, as well as ongoing health monitoring. These usually comprise similar assessments to those carried out by your doctor, and if they identify abnormalities, they will usually refer you to your doctor. Some professions have further checks as a requirement for employment. For example, bus or train drivers need to undergo regular fit to work assessments. Commercial pilots must have a medical certificate that needs updating regularly. Health checks may be requested by external organizations too. Sports bodies require athletes to undergo cardiology screening and test for performance enhancing drugs before they can compete. Private medical and life insurance companies may ask you to have a physical before signing up for a policy. When you join a gym or enroll with a personal trainer, you may be offered a series of baseline health and fitness tests before you start. Some sports footwear specialists provide gait assessments too. Thank you for listening.
Let's discuss interviewing sadness and grief. Sadness includes emotion of regret, as when someone regrets a certain action or decision in the past and the mind is constantly turned towards that time. Sadness and grief affect the lungs and heart. In fact, according to this simple question, sadness affects the lungs via the heart. It says in chapter 39, sadness makes the heart cramped and agitated. This pushes towards the lungs, lobes, and upper burner becomes obstructed. Nutritive and defensive chi cannot circulate freely. Heat accumulates and dissolves chi. According to this passage, then sadness primarily affects the heart and the lungs suffer in consequence because they are both situated in the upper burner. The lungs govern chi and sadness, and grief depletes chi. This is often manifested on the pulse as a weak quality on both left and right front position, the heart and lungs. In particular, the pulse on both front position is short and has no wave. It does not flow smoothly towards the thumb. Other manifestations deriving from sadness and grief includes weak voice, tiredness, pale complexion, slight breathlessness, weeping, and a feeling of oppression in the chest. In women, deficiency of lung qi from sadness or grief often leads to blunt deficiency and amenorrhea. Although sadness and grief deplete chi and therefore lead to deficiency of chi, they may also, after a long time, lead to stagnation of chi because the deficient lung and heart chi fails to circulate properly in the chest. As mentioned before, each emotion can affect other organs apart from its specific one. For example, the spiritual axis in chapter 8 mentions injury of the liver from sadness rather than anger. When sadness affects the liver, it injures the ethereal soul. This causes mental confusion. The yin is damaged and the tendons contract and there is hypochondrial discomfort. This shows how organs can be affected by emotions other than the ones specific to them. In this case, sadness can naturally affect the ethereal soul and therefore liver yin. Sadness has a depleting effect on chi and therefore in some cases depletes liver yin, leading to mental confusion, depression, lack of a sense of direction in life, and inability to plan one's life. Finally, some doctors consider that grief, which is unexpressed and born without tears, affect the kidneys. According to them, when grief is held in without weeping, the fluids cannot come out in the form of tears and upset the fluid metabolism with the kidneys. This would happen only in situations in which grief had been felt for many years. For the summary, sadness and grief, they affect the lungs and heart. They deplete chi. In time, they may also lead to stagnation of chi. Sadness also may affect liver blood in women. Unexpressed grief without tears affects the kidneys. Thank you for your attention.
Let's continue our discussion on Foot Yang Ming, the stomach meridian, now stomach 2 or the 4 whites. Stomach 2 is located 3 chun below stomach 1 in the depression of the infraorbital foramen. Stomach 2 or 4 whites, grain gate or 4 brightness as it's called, is a point of the yang chao mai. 4 whites refers to the 4 white areas of the eye, above, below, and to either side, and is used for a similar range of symptoms as stomach 1, where there is inflammation, pain, allergic rhinitis, facial paralysis, or tic, internal and external wind invasion. It is considered less effective than stomach 1, although there is less risk of bruising. Local point for trigeminal neuralgia, facial paralysis, allergic facial swelling, sinusitis, and sinus headache, hyperthyroidism with protruding eyes. So as seen here in the picture, although not major point, C by stomach 2 may be used in the following 3 clinical situations as a substitute for Chengchi or stomach 1 in the treatment of eye diseases for those who have not mastered the more difficult technique of needling the latter point as a local point, often joined to the adjacent points for facial pain and paralysis. And 3 in the treatment of roundworms in the bile duct. Indications: eye disorders, nasal disorders, rhinitis, sinus. The combination would be superficial visual obstruction would be stomach 2, bladder 1, and LI4. For headaches and visual dizziness, stomach 2, kidney 1, and bladder 11. Consider the orbital neuralgia feeling of smoke in the eyes, poor distant vision, trigeminal neuralgia, sinusitis, rhinitis, or facial paralysis. Its alternative name of grain gate refers to the mouth, which is the gate of the stomach. Location. With the eyes looking straight ahead, directly below the center of the pupil, in the depression of at the infraorbital foramen. How to find this? With the patient looking straight ahead, the first 4 points of the stomach channel are located on a vertical line drawn through the center of the pupil. Within the area of the lower eyelid, the infraorbital ridge presents itself as a distant bony structure starting at the infraorbital ridge. Palpate inferiorly until you can feel the depression of the infraorbital foramen. This is often located slightly medial to the pupil line, where stomach 2 is located. Needling zero point 0.3 to zero point 0.5 tune vertically or transversely, subcutaneously towards SI18 or LI20. For example, in the case of facial paralysis. Deep needling in an oblique cranial direction is contraindicated. Caution infraorbital nerve eye injury. According to some classic texts, moxibustion is contraindicated. Actions and indications: benefits the eye, clears heat, eliminates wind. Special features: important local point for disorders of the eye, pain and paralysis of the face, meeting point with a yang chow mai according to some authors, a less risky substitute for stomach 1. Thank you for your attention.
Let's discuss kidney patterns, kidney yang deficiency. Concept: this is a type of deficient cold pattern and is due to kidney yang deficiency leading to abnormality in warming and qi transformation. Clinical manifestation: bright white or dark complexion, cold soreness of the lumbar region and knee joints, cold body and cold limbs, especially worse in the lower limbs, mental fatigue, lassitude, impotence, premature ejaculation, and coldness in the perineal region in males, cold uterus leading to infertility, low libido, diarrhea at dawn, maybe clear frequent urination, nocturia, possibly scanty urine, edema of the whole body, pale tongue with white coating, and a deep, thready, and weak pulse. Key symptoms: hypofunctional sexual activity and reproduction, failing to control discharge of stools and urine, and symptoms of a deficient cold pattern, such as cold soreness of the lumbar region and knees, cold body, and limbs. So here, the analysis of kidney yang deficiency. If there is hypofunctional reproduction, the male, there is impotence, premature ejaculation, and coldness in the perineal region. For the female, cold uterus leading to infertility. If there's inability to control stool and urine discharge, there's bladder, the bladder fails to govern fluid, resulting into profuse and frequent urination, nocturia. When the large intestine fails to transmit waste, there is loose stool or diarrhea at dawn. Hypofunctional qi transformation, there is scanty urine or edema. If there is yang deficiency causing relative yin excess, he fails to warm the back and knees, resulting to cold soreness of the back and knees. If there is failure to warm the body, there is cold body and limbs, especially the lower limb. Yang deficiency engenders internal cold, resulting to bright white complexion. Exhaustion of kidney yang, when the yin fills up the skin and flesh, there's blackish complexion. Fails spirit, there's mental fatigue, lassitude. A pale tongue with a white coating and deep, ready, and weak pulse indicate kidney yang deficiency. For the summary of the kidney yang deficiency, the etiology: chronic illness, excessive sexual activity, exposure to cold after sex, retention of dampness from spleen deficiency, old age. Underlying accompanying pathology: kidney yin deficiency, spleen qi deficiency, retention of dampness. For the signs and symptoms: lower back ache, cold and weak knees, sensation of cold in the lower back, feeling of cold, weak legs, bright white complexion, tiredness, lassitude, abundant clear urination, nocturia, apathy, edema of the legs, infertility in women, loose stools, depression, impotence, premature ejaculation, low sperm count, thin sperm, decreased libido. For the pulse, deep and weak. For the tongue, pale and wet. Treatment principles, supplement and warm kidney yang. For the acupuncture treatment, we use bladder 23, supplements kidney. Ren 4 supplements kidney yin, essence. Ren 6 fosters original qi, fortifies yang. Bladder 52 supplements kidney and essence. Stomach 36 fosters original qi. Do 4 supplements kidney yang. Kidney 3 supplements kidney yin, essence. Kidney 7 supplements kidney yang. Extra point supplements kidney yang. Needle with supplementation and moxa for severe water swellings. We use spleen 9 and Ren 9. To supplement spleen, large intestine, we use bladder 20, spleen 6, bladder 25, stomach 25. For heart and kidney deficiency, we use heart 7, bladder 15, pericardium 6. Analysis. This pattern is due to innate yang deficiency, Ming-Men fire deficiency in old age, or chronic diseases impairing kidney yang, or excessive sexual activity gradually declining kidney yang. Relevant advice, the patients should consume a diet that is warm in both its temperature and its energetic dynamic. They should completely avoid foods and beverages that have a cold dynamic and that are cold in their temperature, especially in winter. In practice, this means avoiding fruit unless it is boiled or baked, salad, raw vegetables, and cold drinks. They should try to use more warming cooking methods when preparing food, such as oven bake and grilled dishes, which are more warming than steamed and cooked dishes. Hot spices such as chili are not necessarily salutary because they will cause the person to sweat and thereby lose heat. Tonifying blood condition, deficient condition is something that takes time and cannot be forced. The use of spices in general is helpful, though, as they can activate yang. Spices that warm and tonify kidney yang are cinnamon, cloves, fennel, basil, sage, fenugreek, horseradish, rosemary, and black pepper. Foods that specifically tonify kidney yang are oyster, smoked fish, salmon, tuna, lobster, trout, mussels, shrimps, lamb, venison, duck, roast pork, kidney, chestnut, walnut, pistachio, black sesame seed, quinoa, oats, buckwheat, millet, aduki beans, black beans, dew poi, lentils, raspberry, and cherry. Green tea is cooling, so black tea will be better. Otherwise, ginger tea, fennel tea, yogi tea, and jasmine tea will all be good. A person who is kidney yang deficient must ensure that they get enough exercise. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. They must, however, be careful that they do not train so intensely that they become fatigued or tired, because this will further drain their yang. It is a good idea to start the day with physical activities that can activate and circulate qi. Keeping warm is important, especially in the lumbar region and the area below the navel. Wearing a belly warmer or a woolen stomach scarf around the midriff and lumbar can be recommended. Protecting this area from drafts should be a priority. A ginger foot bath is also beneficial, as is drinking ginger tea. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and yang in general. Besides the above advice, men should limit how much sex they have, including masturbation, as kidney yang deficient is expended upon ejaculation. Lifting heavy objects and standing weakened kidney yang should be avoided as much as possible. Thank you for your attention.
Let's continue our discussion on pulse taking, the abnormal rhythm or intermittent pulse. Regularly intermittent, consistently irregular, or DIMI. Intermittent pulse. In this pulse, the regular beats abruptly pause for several beats and just as abruptly resume. The stopping comes at regular intervals. Clinical significance. An intermittent pulse suggests principally depletion of visceral qi and secondarily severe pains, fright, or trauma. Analysis. Depletion of visceral qi leads to deficiency of qi and blood, so that blood circulation loses its motive force. This causes the periodic pauses. Sudden fright, trauma, and severe pains can all cause chaotic movement of meridian qi with periodic discontinuation of beats. Here we see a pulse which loses a beat and then pauses a little longer before starting again at regular intervals is called an intermittent pulse. To arrive at the tune position, the blood must flow through the C point or lung 5 and through the guan position. This means that it must flow from the interior to the exterior. During the pause between beats, the blood seems to retract, ebbing up to the C point, but when it returns, there can be a double beat. This is described as the lost beat being recovered. If there is not a double beat when the pulse returns, the lost beat has not been recovered. If one pulse beat is missed at regular intervals and is then recovered, the pulse is intermittent. The intermittent pulse can be caused by damage or deficient qi and blood or deficiency of Yuan Yang. If the intermittent pulse appears in a chronic disease, it is necessary to distinguish where the deficiency is to give correct treatment. If the intermittent pulse is suddenly felt in a normal person, a careful diagnosis is necessary to avoid incorrect treatment. Pulse comparison. The hasty, nodded, and intermittent pulses all miss beats, so they must not be confused. A rapid pulse which misses beats is hasty, whereas a leisurely pulse which misses a beat is nodded. Rapid and one is leisurely. They both stop at irregular intervals. However, the intermittent pulse, which cannot recover its lost beat, stops at regular intervals and it pauses for a little longer than one beat. Usually, with a hasty or nodded pulse, the disease is milder, while in an intermittent pulse, the disease is more severe. Clinical significance. The intermittent pulse is usually felt when there is failure and weakness of the Zhang Qi with deficiency of Yuan Yang. It can appear when deficiency and damage of the lower Yuan Qi causes abdominal pain, when weakness and deficiency of the stomach and spleen causes diarrhea, or when weakness of the central Yuan causes vomiting and diarrhea. If the intermittent pulse is felt occasionally after 3 months of pregnancy, it indicates deficiency of Yuan Qi. Thank you for your attention.
Now let's talk about liver yin deficiency. It is rare to see this pattern alone. It will usually be a consequence of or result in kidney yin deficiency. So there will usually be a combined pattern of liver and kidney yin deficiency. Liver yin deficiency is also frequently an aspect of other liver patterns, such as ascending liver yang and liver yin. Liver yin encompasses liver blood. This means that there will be similar symptoms and signs as those that are present in liver blood deficiency. But there will also be specific yin deficiency signs. Liver blood deficiency is often a precursor of this pattern. The etiology will be the same as for liver blood deficiency, especially since liver blood deficiency can often be a precursor of liver yin deficiency. Furthermore, factors that weaken kidney yin and yin in general can be contributing factors. Chronic illness, stress, physical, emotional, and mental overexertion, drugs, excessive sex, working at night, too little sleep, a diet that is hot or drying in its dynamics, too much coffee and other stimulants, congenital weakness, and old age can all weaken yin. Kidney yin deficiency will often arise as a consequence of chronic imbalances in the body. Chronic liver fire can injure liver yin. Symptoms and signs: dizziness, dry eyes, difficulty focusing the vision, matte, pale face with red cheeks, insomnia, dry skin, dry hair, dry or weak fingernails, cramps or restless legs in the evening and at night, tingling or numbness in the arms and legs, sparse menstrual bleeding or amenorrhea. The person may appear to be slightly restless, depression or lack of initiative. The person may seem indecisive and cannot figure out what they want. Thin, dry tongue without coating and possibly with cracks. Empty or fine pulse. If liver yin deficiency has led to deficient heat or empty heat, there can also be night sweats, feeling hot in the evening and at night, a sensation of heat in the palms of the hands and soles of the feet, malar flash, anxiety, thirst with a desire to sip water, dry mouth and throat, menorrhagia or metrorrhagia, a red thin tongue that lacks coating, a rapid and fine or empty pulse. Key symptoms are dry eyes, dry skin, lack of tongue coating, and a fine pulse. Treatment principle, nourish liver yin. We can choose from bladder 18, 23, 52, liver 3, 8, ren 4, spleen 6, kidney 3, and 6. Needle technique, tonifying. Liver 3, 8, bladder 18, and spleen 6, nourish liver yin. Bladder 23, 52, ren 4, kidney 3, and 6, nourish kidney yin, which is the root of the liver yin. It is essential that the person who is liver yin deficient gets enough rest and relaxation. This means that they must have ample sleep and go to bed early at night. They must not work too hard nor spend too much time watching television and staring at computer screens. They should avoid stimulants such as coffee, which would stress their system. Alcohol is not good for them because it is both spreading and warming in its energy and creates heat in the liver, which can injure liver yin. Dynamic activities such as aerobics or action sports will be detrimental and should be discouraged because they will further consume yin. The person should instead cultivate gentler and more meditative forms of motion such as qigong, yoga, and tai chi. Massage and meditation are especially beneficial because they increase peace and tranquility in the body and thereby benefit yin. The client should try to avoid foods that are stimulating and warming. This includes coffee, alcohol, dark chocolate, and hot spices like chili. Generally, concentrated proteins, cereals, and root vegetables nourish yin. Green leafy vegetables will be especially good because the green color will resonate with the liver and thereby directly tonify liver yin. Using a lot of water in the preparation of food, especially soups and stews, is preferable to baking things in the oven, which is more drying. Oil and products that have a high oil content, such as nuts and seeds, will nourish and moisten yin. Foods that specifically nourish liver yin are artichokes, beetroot, tomato, avocado, sweet seaweed, dates, grapes, lemon, nettles, olive oil, lima beans, mung beans, kidney beans, pine nuts, sesame seeds, tahini, crab, oysters, beef liver, and rabbit. Liver yin deficiency can be caused by liver blood deficiency, kidney yin deficiency, and liver fire, and can result in kidney yin deficiency, heart yin deficiency, ascending liver yang, and liver qi stagnation. To summarize, the etiology of liver yin deficiency is a diet lacking in nourishment, excessive use of drugs, chronic illness, too much sexual intercourse, overexertion. Underlying accompanying pathology, kidney yin deficiency, liver blood deficiency, may allow yang to become hyperactive and even wind to stir internally. Signs and symptoms: dizziness, headache, blurred vision, visual floaters, dry eyes, poor night vision, scant menstruation or amenorrhea, numbness and tingling of the limbs, insomnia, dull pale complexion with redness around cheekbones, muscular weakness, cramps, brittle nails, very dry skin and hair, depression. Pulse floating empty, tongue normal color and peeled. Treatment principle: enrich yin, nourish blood. Acupuncture treatment: bladder 17 with moxa will supplement blood, bladder 20 will supplement spleen to produce blood, bladder 23 supplements kidneys to produce yin, Liver 8 nourishes liver yin and blood. Spleen 6 regulates liver, nourishes yin. Kidney 3 supplements kidney yin. Stomach 36 nourishes yin and blood. Ren 4 nourishes kidney yin. Kidney 6 nourishes yin, clears empty heat, and the extra point Yuya will benefit the eyes. Needle with supplementation. For ascendant liver yang, add DU20, GB20, GB43, and kidney 1. Thank you for listening.
Now let's talk about skin inspection, erosion, ulceration, eczema, and fissures. Erosion of the skin leaves a wound surface that is wet with serious fluid. Erosion tends to be shallow, and when healed, there is no residual scar. If the wound surface is bright red and wet, with slightly yellow clear fluid, it is mostly due to injury by dampness and heat. If the exuded fluid flows to adjacent skin and induces blebs by contact and the eroded surface is covered with a yellow-brown crust, it is mostly due to poisoning by dampness. If the wound surface is pale and slightly red and the exuded fluid is clear and slight in amount, it is mostly due to spleen deficiency and strong dampness. The illustration of erosion. Ulceration. An ulcer is the result of festering and breakdown of the skin, with pus exuding from and covering the wound surface. The damage is deeper than in the case of erosion, and after healing, there is residual scar. Ulceration may be acute or chronic. An acute ulcer is red and inflamed, with swelling and pain. It is mostly due to poisoning by heat. A chronic ulcer is characterized by dusky granulation tissue. It is mostly due to deficiency of qi and blood. If the granulation tissue is edematous, the cause is mainly the strong dampness. Illustration of ulceration. Eczema. Eczema is common in clinical practice. It is an inflammatory allergic skin illness and is usually the result of triple attack by external dampness, heat, and wind. These pathogenic evils struggle in the skin, and their interaction leads to impeded blood circulation and disharmony between the nutritive qi and defensive qi. Eczema has a polymorphic presentation. It may be macular, papular, vesiculated, pustular, eroded, covered with exudate, or scabbed. It is especially common on the face, behind the ears, on the hands, the scrotum, the armpits, and the shanks. If persistent, eczema becomes chronic. The affected skin becomes thickened, dry, and coarse, and lichenous with altered skin pigmentation. Chronic eczema suggests that illness is long-standing and well-established dampness, has given rise to the fire and has damaged fluids and blood. As a result of blood becomes deficient and endogenous wind arises, causing dryness and loss of skin nourishment. Fissures. Fissures tend to occur in the palms and dorsa of the hands, the fingers, the heels, and the toes. They tend to develop in winter. Typically, the affected skin is dry, thickened, and hardened, with loss of elasticity. As the condition worsens, the skin tends to crack and form fissures. Deep fissures may be painful and may bleed. When yin fluids are insufficient and qi and blood are disharmonious, the skin loses its nourishment. If, in addition, it is attacked by wind, cold, or another pathogenic evil, blood circulation becomes sluggish and the skin becomes dry and may crack. Illustration of fissures. Thank you for your attention. Now let's talk about the erectile dysfunction, the Chinese medicine concept. Erectile dysfunction in Chinese medicine. ED is called Yang Wei in Chinese medicine. Yang means yang. Bing is the radical indicating a disease. Wei means listless or withering. Therefore, the term yang wei indicates a disease characterized by the listlessness of yang. Interestingly, the ancient term for impotence was actually yin wei, in which yin refers to yin, as in yin yang. This difference in terminology is probably due to the fact that yin in yin wei refers to the pennies that is called yin jing in Chinese, which literally means yin stem. In ancient times, impotence was also sometimes called jinwei, which means the listlessness of the sinews or the sinews. This name is probably related to the term zongjing or ancestral muscle or sinews, which was another term for the pennies. Chapter 70 of the Simple Questions mentions impotence, calling it yin wei. When the energy of greater yin predominates, there is impotence from a great decline of qi with inability to rise. Chapter 44 of the Simple Question says, when one is affected by desire without satisfaction and pursues outside excessive goals, or when one engages in excessive sexual activity, the penis, zongjin, ancestral muscle, will become slack, causing impotence, jinwei, and seminal emissions. Chapter 5 of the Simple Question says, at 60, there is impotence, a great deficiency of qi, and the orifices are obstructed. Chapter 13 of the Spiritual Axis on the muscle channel says, when the muscle channel of the terminal yin of the leg or the liver is diseased, the sexual organ cannot be used. The secret formulae of the border official by Wang Tao clearly relates impotence to the kidneys. The kidneys control the lower orifices. Overexertion injures the kidney. The deficient kidneys cannot control the lower orifices, and impotence results. The discussion of the origin of symptoms in diseases by Chao Yuan Fang clearly related impotence to the kidneys. The genitals are an orifice of the kidneys. When these are injured by overwork, the deficient kidneys cannot nourish the genitals and impotence results. The complete book of Jingyu or Jingwei by Zhang Jiebin relates the etiology of impotence to emotional stress. Worry and pensiveness deplete qi, and excessive worry leads to impotence. Thank you for your attention.